Hello, my name is Jenny, and now I will present you guys about understanding cancer. So, what is cancer? So, cancer is a disease where cells grow uncontrollably in the body, and it would form tumors. And these tumors inside your body can spread to other parts of your body. So, like this, first is the cell, and then this is keep increasing, growing, and the genes cannot say it stop. So it would make like a big chunk of meat inside your body and you have to remove it. That's why cancer is very, very dangerous. So this is the difference of cancer cells and normal cells. So normal cells, they grow, they divide, and they die. And it's controlled by the genes. But cancer cell, they divide rapidly. It doesn't die, and it ignore the signals of the genes, and it's form tumors. So that's why. That's the difference. And what is the curse of the causes of cancer? So mostly cancer happen because there's mutations in DNA that control cell growth. So these mutations might be caused by genetic factors, environmental factors, lifestyle, and infections. We will talk about it more later. And there's hidden risk of cancer too, like chronic inflammations, maybe because of your body is like have inflammations. That's called like body stress, or maybe poor sleep. If you lack of sleep, it can also cause cancer in long term. Stress hormones. If you have a lot of stress and you like secrete a lot of stress hormones, could cause cancer too. Or maybe you eat too many processed food and sugar. Okay, so we will go deeper into the main causes of cancer. So the first one is genetic inheritance. So basically, if your parents or your grandparents have the genes that cause cancer, you are more likely to have cancer yourself. You have higher risk of cancer. So family history is very important. It can increase chances for you to get cancer. Okay. The second one is environmental factors. So maybe you don't smoke, or you don't drink, or you don't like stay a lot to a lot of places that have radiations, but maybe the person that you stay around smoke, or like you walk around places that have like radiations, or even sunlight can cause cancer. Like sunlight can cause skin cancer. And if you are around people that smoking, it can cause lung cancer. Third one is lifestyle factors. So if you smoke, then you have very, very high risk of getting lung cancer. Or you drink alcohol, can liver cancer. Unhealthy food and no exercise. These can cause your body to be weaker, and so your genes easily mutate. That's why it causes cancer. And the fourth one, some viruses can also cause cancer. So maybe you don't smoke, the environment is okay, you don't have like a family history, but then some virus can cause cancer, like human papillomavirus can cause cervical cancer, or hepatitis B virus can cause liver cancer. So these are the symptoms if you get the virus that causes cancer. Okay, so what type of genes that involved in causing cancer? So there's two types. There's oncogenes. Oncogenes promote the growth. So when it's mutate, it would make like these genes will overreact to make the cell grow too fast, and it's uncontrollably, and it cannot stop. And the second one is tumor suppressor genes, which mean this gene would be the one who sends stop signal. But when it's mutate, it stop working. It doesn't send the stop signal. So your cells would keep growing even when it's damaged. So damaged cell growth, it would cause tumor. So this is an example. Normal genes affected by radiation, sunlight, or like any bad factor, smoking, and then it would have like mutations, and it's cause cancer tumor cell. So what is the process of cancer development? First, your DNA would get damaged, maybe because of your body is weak by those causes that we talked before. and then this mutation is happen in the DNA, and then the cell divisions, because of the DNA already damaged and have mutate, the cell division would also get affected. Maybe is grow too much, or it won't die, or it's get damaged but keep growing, and then tumor would be formed, and then that tumor would spread to other organs. Okay, so we already understand cancer. Now let's look at the cancer data. So the most common cancer worldwide are lungs cancer in general, trachea, bronchus, and lungs, all basically lungs, and then breast cancer, colorectal, prostate, stomach, liver, and bile ducts. This one is both sexes, with men and women in general. And how about the most common cancer worldwide, but separate into men and women? So the most common cancer worldwide for men are lungs, and for women are breasts. So, however, we can still in women, lungs are still the second most common though. So there's a question: why men and women would be different, right? Well, basically, mostly because we have difference in organs. So men have prostates and women have breasts. So it can be like, because men don't have breasts, so they would have less. The data would be lower than to breast cancer for women. The hormones can affect cancer risk, especially in women. And maybe lifestyle, men tend to smoke more and drink more alcohol, so they have higher risk of lung or liver cancer. And maybe health behavior, so women are more careful, so tend to more careful. I'm not saying everyone, but tend to more careful, so they might be the one who initiate to do checkup or screening. So men are tend to be more later diagnosis. Okay, so what is the difference of cancer in Taiwan and Vietnam? Since I'm a Vietnamese student staying in Taiwan, so the top diagnosis and top killer in Taiwan are lung cancer, while Vietnam is liver cancer. So the reason why, maybe because in Taiwan, the aging society and air pollution and maybe genetics, that's why lung cancer is the top diagnosis and killer. While in Vietnam, maybe it's of the virus, hepatitis B, C, alcohol, and smoking. That is mostly the lifestyle. And these are the treatment for those cancers. So we all know that lung cancer are the top one in Taiwan, right? So there's more information here. So lungs are the leading cause of cancer death for more than 20 years already. And the big three cancers in Taiwan also are lung, colorectal, and female breast cancer. So there's one more very different information for you to know, that 50% of lung cancer patients are non-smoker. So you need to be careful even around people who like smoking, because even if you don't smoke, you still have very high chance of having lung cancer. So for Vietnam, the most common are liver cancer, right? It is the leading cause of cancer death, 21% of all cancer death. So the main cause are, the highest cause are like hepatitis infections. And also lifestyle, of course. And other common cancer in Vietnam are lung and breast cancer. So, very important questions here. Can cancer be prevented? Well, from my research, they say yes. About 40% of cancer are preventable. And almost 70% of people diagnosed with cancer have survived. There's more data here, first is about Taiwan and Vietnam. So the 5-year cancer survival rate in Taiwan and Vietnam, you can see here, if all cancer combined, Taiwan have like approximately 61% of survival, and Vietnam are like 33 to 43%. And if you see all these cancer here, you can also notice that Taiwan have higher rate of survival compared to Vietnam, and maybe the reason is they have like earlier detections, they have better surgical access, and also Taiwan free LCT scans is really help they early stage diagnosis and can help they increase their survival rate for cancer people that suffer from cancer. So even though we can see the number like this, however, I already researched and then I found that Vietnam right now is also trying to improve our method, our detections, and our surgical access. So here are the cancer survival rate in UK, US, and Netherlands. Western countries very advanced in medical access. So this is 1 year cancer survival. You can see the number very high, almost 100% people survive from cancer, prostate, breast, colorectal, lungs. Lungs are the lowest, have the lowest percent in survival. So you need to really be careful about like smoking or like be around people who smoke, because if you suffer from lung cancer, even in a very advanced country like US, UK, or Netherlands, the percent of survival is still very, very low. The highest is just 50%. So 5 year even lower, but still lung cancer are the lowest, and maybe breast and prostate are still have a higher chance of survival. Okay, so what is the diagnosis and treatment for cancer? Just for you to know more, you need to know the size of symptoms if you suffer from cancer. So maybe you get fatigue or tiredness, suddenly weight loss or gain, or you have swelling or lumps, or you cough, or maybe suddenly you bleeding, you have bruisings, or like you have pain when you urinating, or like blood in the urine. Maybe your visions or your hearing start to be worse, or you suddenly have fever with night sweat and have really bad headaches. So you need to really notice on these symptoms. If you have any of these symptoms, really need to reach the hospital. So what is the treatment? We have a lot of treatment for cancer. It's very based on different type of cancer. So first one, very common, surgery, radiation therapy, chemotherapy, target therapy, immunotherapy, a lot of treatment. However, these treatment all will give you very long-term effect later. So you need to start to like prevent it from now on. However, there's some news for you to see. We already have much better. The more the generations still keep growing right now. Better treatment of cancer already be published, and still you need to take care of your health from the very start, not to let it happen and then think that maybe later on you will have better treatment. Well, still this is good news for people who have suffered or is suffering from cancer. They would have better treatment. Okay, so this video is for you to understand more about what is the cause of cancer, the anatomy of cancer, and what really going on inside your body when you have cancer, if you're interested. Okay, so the conclusions. So cancer is very complex biological process, but it's not a mystery anymore, because now there's early diagnosis and there's rapidly advancing treatment from surgery to immunotherapy. Those treatment already improve the survival rate right now and maybe will be even better in the future. Well, however, the fight against cancer is ongoing, but with continued awareness, which means you need to prevent it first, and medical innovations, of course, in the future, the outlook for patients is more helpful today than ever before. So thank you. And if you're interested in, these are the reference. That's the end of my presentation. Thank you.